Hi there, my name is Alice and I work for East Sussex Sexual Health. Today, my colleague Sophie is going to talk to you all about HIV. But before we hear from Sophie, it's important to remember that STIs like HIV can be prevented by wearing condoms. You can pick up free condoms from eastsussexsexualhealth.co.uk, or you can pick them up from your local sexual health clinic. You can also buy them in pharmacies and supermarkets. STIs are super easy to catch, but they're also super easy to treat, so there's never anything to be ashamed of. Here's Sophie to tell you all about HIV.
If someone with HIV has a detectable viral load, they can pass on HIV through the following bodily fluids: blood, semen, including pre-cum, vaginal fluid, anal mucus, and breast milk. People can get HIV through heterosexual and homosexual sex without a condom, sharing drug injecting equipment, sharing sex toys, mother-to-child transmission, coming into contact with contaminated blood. Most activities pose no risk of getting or passing on HIV. HIV cannot be passed on by kissing, hugging, shaking hands, sharing space with someone, sharing a toilet, sharing household items such as cups, plates, cutlery or bed linen, and other general social contact. Once outside the body, HIV usually can't survive very long. Coming into contact with blood or semen that has been outside the body doesn't generally pose a risk for HIV transmission. Most people experience a short flu-like illness 2 to 6 weeks after the HIV infection, which lasts for a week or two, often described as the worst flu ever. After these symptoms disappear, HIV may not cause any symptoms for many years, although the virus continues to damage your immune system. This means that many people living with HIV do not know that they're infected. Early symptoms of HIV may include swollen glands, a rash, fatigue, muscle, joint aches and pains. Anyone who thinks that they have HIV should get tested. Certain groups of people are advised to have regular tests as they are particularly high risk, including men who have sex with other men, black African heterosexuals, people who share needles, syringes, or other injecting equipment. Seek medical advice as soon as possible if you think you may have been exposed to HIV. You can get tested in a number of places, including at your GP surgery, sexual health clinics, and clinics run by charities. You can even order a home test kit sent via the East Sussex Sexual Health website. The only way to find out if you have HIV is to have a HIV test. This involves testing a sample of your blood or saliva for signs of the infection. Both positive and negative HIV tests may need to be repeated 1 to 3 months after potential exposure to the HIV infection. This is known as the window period, but you should not wait this long to seek help. If your first test suggests that you have HIV, a further blood test will need to be carried out to confirm the results. If this is positive, you'll be referred to a HIV specialist clinic for some more tests and a discussion about your treatment options. HIV medication keeps you healthy so that you can live a normal lifespan. HIV is treated with medications which work by stopping the virus replicating in the body. This allows the immune system to repair itself and prevent further damage. Treatment can also reduce your viral load to an undetectable level so that you won't be able to pass on HIV to anyone else. It can take up to 6 months from starting the treatment to become undetectable, so it's really important to test and start your treatment on time. people with HIV who are on an effective treatment and have an undetectable viral load cannot pass on HIV through any of their bodily fluids. If you think you've been exposed to the virus, post-exposure prophylaxis, PEP, medicine may stop you becoming infected. PEP must be started within 72 hours of coming into contact with the virus for it to be effective. It's only recommended following higher risk exposure, particularly where the sexual partner is known to be positive. Using a condom correctly prevents contact with semen and vaginal fluids and blood, stopping HIV from being passed on. The virus cannot be passed through the latex of the condom.
So, if you are concerned that you may have HIV or you've had unprotected sex and you've never been tested, it's a great idea to get an STI test as soon as possible. To find out how to get an STI test and how to conduct one, find videos on our YouTube page, along with videos about PEP and PrEP, which are game changers in the world of HIV. If you have any other questions for us, you can reach out to us via our social media, via our website, or via phone.